Wow, here we are again. It's been moving fast and very exciting. Last session was phenomenal. We discussed treatment planning. We discussed how to sit, how to talk. Got a lot of feedback about that. Really helpful. Doctors wanted more. They want to know about how to integrate. But what I've been noticing in the practices and through my daily occurrence in dealing with doctors is I really think there's a definite disconnect between the use of the respected hygienist and the non-use of the hygienist. And that's what I want to discuss today, because I think that is the last piece, but the most important piece of treatment planning, especially in great offices. I want to say this before I start. I've seen some unbelievable offices that has hygiene as 15% of top line revenue. And then I've seen offices that are amazing with 32% of top line revenue. If you think about it, if they're doing the same, the doctor is working harder. So my opinion is that hygiene bores out and gives us so much. I'm just thinking of all the years, and I'm going to touch on this, some of the great hygienists I worked with. We'll go nameless, sorry, ladies and gentlemen, but they were amazing. And hygiene, well accepted, well integrated, can be one of the most important aspects of the practice. Let's face it. It's the second person that's touched, maybe third, maybe the assistant sat the patient, the front desk saw them. They came in, filled out their paperwork, assistant sat them. Third person, first person with their hands in the mouth is the hygienist. First person that walks into my practice. I make a living. I support my family. I feed my family. I support everybody else's family within the practice. The first person that touches that patient is our hygienist. That's why the hygienist is really important, and it's something to talk about. And I think at this point, I want to lend my experience of what I believe should be the way to go with a hygienist. I think that the difference between me and some of my colleagues, and I talk about it with other doctors, is I look at a hygienist as a simple provider. They're not going to extract teeth. They're not going to drill crowns, but they are treating our patients. And I think that is the distinct difference between somebody that utilizes the hygiene and the hygienist into moving treatment along from operatory to operatory. We'll discuss that in a minute. But what I'm looking for is a hygienist that gives me the ability to do quality dentistry, comprehensive dentistry, and yes, same-day dentistry. And I think same-day dentistry is the key with hygiene. And I have that off the top of my head. You can see some hygienists that pride themselves on committing the patient to same-day dentistry. And it's better for the patient. They don't have to make another trip. It's obviously better for the practice, especially if there's an opening. And it's just better for the patient because they have done the work they wanted to do and they put off for so long. But every office is different. There's not an office out there that's the same. This is not vodka, it's water. But I need a sip. And I just want to say every office is different. Some doctors do not utilize the hygienist to steer their patients towards treatment. They don't. They want their hygienist to clean the teeth, 35 minutes, go over any health emergencies, any health care concerns, and dismiss the patient or wait for an exam. They don't ask the hygienist to probe, which I think is the standard of care. Next question would be a simple question. Do you do arrestin? How could you do arrestin if you don't probe? You're just putting it in areas that are bleeding. Some offices do not want the hygienist to bring in, initiate treatment discussions, whether the teeth are broken or not. To me, that's leaving a tremendous amount of dentistry undiagnosed, because I believe having two heads are better than one, but also some dentistry missed. If we're not probing, we're not looking, doctor's very busy. If he or she comes in and doesn't do a thorough exam, we're missing out on some very important dentistry. I also believe that the ability of some of the hygienists I have worked with, and it's been a number, but thank God we've had maintained some hygienists for a very long time, can handle all the tasks in an hour that we discuss. It's x-rays, it's probing, it's cleaning, it's educating, and then it's transferring the patient to the doctor. I also think that through the years, and we touched on this last week, through the years, somebody like myself, I'm very experienced. I've had a lot of years. I know what I'm looking for. And I will have that discussion, whether it be a new hygienist or somebody who needs us to discuss some things. Maybe we're integrated a new procedure, a new program. We would discuss that, because I think that a hygienist really is the the bridge, a very important bridge between the doctor and the team. And I say that because it's a tremendous amount of power. I mean, let's think about that. I'm going to talk about that a lot right now. And that is that we have a hygienist that's been there for 10, 15 years, say. She's making more than anybody else. Sometimes she's tripling some of the assistants, or at least doubling. And she's considered a provider, but she does educate. She does hang out with the team. She's very close with the staff. For me, it's always been hygiene and team and doctors. But yet, if you have a hygienist that could bridge the gap, I think it's wonderful. We like to integrate our hygienists into formulating treatment plans. I think it's sort of like a very strategic handoff. These are professionals, trained providers that are looking at pathology. And I always tell them, through your experience, it looks like the tooth may be needed to be treated. You jot it down, and you have the ability to really affect the day of the practice. You could bring in the doctor, you could discuss treatment, you could say the patient really wants to get some things done because they've traveled. Now the doctor knows they're interested. There's a list of things that the hygienist thought about or talked about and showed the patient what she was thinking without making a diagnosis. The doctor comes in, checks the patient, looks at the patient, and then goes through the list. He or she may find other things because my hygienist puts up the probing depths. We already know we're going to get 7 arrestins. We already know one area may need a periodontal, but we're going to do some scaling and root planing. We already know that. What we're discussing is the broken tooth in the upper right. Does it need root canal? As the hygienist mentioned, that if you're in pain, let's get the doctor to look at it, or does it not? And if it doesn't, then let's get it fixed right away. And if it does, let's get it fixed right away so it doesn't become an abscess, an infection of more of a broken tooth. This is where I think the seamless transition between hygiene and doctor is actually, to me, invaluable. It's invaluable because I walk in and I've got a list, look in the mouth. I now have 11 or 12 areas of concern that I want to be treated. And it was expeditiously done. I could discuss with the patient what I believe should be done first. The hygienist could then help us in fortifying that and said, Mary, that's what we discussed. It's the same tooth. Dr. Liechtung is just looking at it a little more closer and giving you a diagnosis. It needs a root canal. Unfortunately, the hygienist was right. It is pretty damaged. She was right from her experience, but it is just fortifying us. There are many practices I see when we initially take it over. I asked the hygienist where they're going. They said, Dr. Jones likes us to walk out of the room and be alone. And I say to myself, why? Why do I have to bring in an assistant to help me when the assistant could be doing something else in another operatory, getting me set up for my next procedure? Hygienists own that hour. They should benefit from some of the things they do learn. And I mean the Arrestins. To me, Arrestin has been an amazing product, and I've seen it work. Is it abused? That's our job, doctors. Our job is to make sure that we are delivering treatment that's needed. So we have to police the hygienist as well. If they put down on charting 6 millimeter pocket and we look on the x-ray and it looks like a 12-year-old boy that is very healthy and has gums up to the CEJ, we will question her outside or him outside the room because I want the best for my patients. But in my years, I have worked with some great hygienists that have delivered great dentistry for me and delivered great second opinions for me. And I think that is the issue, the biggest issue that hygiene can bring us. Assistant, a front desk, they cannot bring us that confirmation, the affirmation of the treatment. A hygienist does draw patients in. Remember what I say to the hygienist out there. They have tremendous power. And with power comes responsibility. It's their responsibility. They are educated. They do socialize, like I said, with the other side, with the team. Not the other side, but the team that's not the providers. So they are the sort of like the galvanizing group that brings us together. I had a hygienist for many years. She was excellent. No names, but she moved to Ohio, I believe. And she was tremendous about really educating the team. And I found that production and hygiene was up because we got smarter and we watched our probings, we watched what we delivered. And for me, it was an exceptional situation. And that's what we aspire to. We still have great hygienists. I do want to say one thing about last week. We had a discussion last week, and I like to bring it all in and just discuss that a little bit. The discussion last week was more about, the new doctor and what does the new doctor do? I must tell you that I believe that a new clinician coming into an office should make it her or his responsibility to find time to ask the owner or the managing person of the practice that you would like to talk to the hygienist. You would like to get on the same page as the hygienist. Maybe you're a lefty and you like to put the Post-it or the list on the bracket table to my left. Maybe you're a righty and you don't care where it goes. Maybe you don't want it to go in the operatory. Maybe the system of the office could be something you mesh well with and don't have to change, or you'll discuss with the hygienist how we can integrate the office policy with what you're comfortable with. There's no reason not to have that discussion. And in the end of that situation, what you do have is you have an amazing situation where you're walking into an operatory and it's literally taking you half the time to treat and plan more treatment and getting that patient done and getting that patient working that day into an operatory to do the treatment. I think it's amazing when we have somebody like that. I am not a fan of temp hygienists. I do believe that we need them sometimes, but what I mean by that is it's just so much to download to them that if they're seeing a full slate of patients, it does run into a risk of having somebody not treatment planned, not going according to the culture. We'll start bringing that in, the culture of the practice. And that's something that I do like to talk about, because we are seamless in when we see patients and when we go into, different discussions. So we would like that to be absolutely going from one person to the other. And I find that when you bring in different hands and start it up, it's a little confusing. And that's why I urge the young doctors to have that conversation with hygienists, to have that conversation even with your assistants. Where do you like the material? How do you like it? Don't just go into an operatory and say, I don't know, she didn't give me anything. It was nothing really exciting. We talked about culture, and hygiene is amazing, because I think that what I've seen is if you have a well-integrated, well-heeled hygienist, you're going to see the best practices, just on the whole. I know there's a couple out there, like I said before, that are outliers, but those hygienists really galvanize, bring the patients together and bring the staff together. The staff looks up to them. They have to realize that. And with that, they have to really work hard at being more of a leader if they're not, and understand they bring a tremendous advantage to the practices. I have a practice that I got to tell you, almost 9 out of 10 patients come to see that hygienist. They love her. And that's a big draw. And with that, you got to balance. Do I tell her? Because it'll mean more money. We have to really be, we touched on it last time. We have to be really accepting of our team. We have to compliment them. We have to give them advantage of growing and learning. And we have to give them the ability for a personal advancement through financial advancement. With the hygienist, I believe that having an arrestin program, it's my experience that an arrestin program is quite amazing. It gets the hygienist very involved, very much probing and formulating their own schedule with perioscaling and root planing. And I see that a tremendous advantage. And when they get involved in that type of work, they find more dentistry. They always say dentistry begets dentistry. So if you're deep cleaning, you'll find root caries. If you're going in and you probe to a calculus spot, now you find 3 more millimeters, you may need to clean it out. That's a good thing that we found it. I'm not just talking about money. I'm talking about down the road, we could lose teeth if we don't find it. So my opinion of the hygiene program is they have so many things to grow. In our offices, we want to institute sleep. And where do you think that is instituted through? The hygiene program. We needed patients to be asked the question of how your sleeping pattern. Do you wake during the night? Are you told you snore? Do you ever wake up unfulfilled with sleep? I mean, there's so much that we could discuss from that hygiene room. If the hygienist stands on ceremony, we have an issue. If they understand they are gifted to help the practice grow, That's an integral part of the practice, and we will have a great, well-running machine. This is all about something that I really would like to dive into, and that's called culture. Culture to me is essential. And it's essential because it's the way practices are run and practices are accepted and grow. If we don't have a great culture, we can have a problem with team. And I don't like to call people staff, but I do, it could be a staff, it could be burdensome. So the culture is really what develops the whole ambiance of the practice. Do we like coming to work? Do we say good morning? And many years ago, I started a very good trend. I say good morning. Good morning. Good morning. Hey, good morning. I lived in New York City. I live in New York City. And, when you live in New York City, you have somebody you have to say good morning to. I was lucky enough to have a doorman. Every morning I walk out. I don't want to be a grump. I'm in a bad mood. Mondays are not my best day, but I say good morning. And I feel that there is no reason not to take that to the team, to the office. And every morning I like to walk in and say, good morning. How is everybody? And from there, we grow. From there, it just starts us off in such a different light. Everybody is, I'll tell you something. I met a staff member for the first time after weeks of not getting there to meet her. And a lot of things were said. I'm sure Dr. Liechtung going to come in. He's going to talk to you. She was nervous. What is he going to say? What is he going to do? I walked in. I spoke to her. And I said, wow, you're awesome. You're really great. I mean, I love the way you communicate. You need training, but you speak very well. And I said, before I said that, I said, where do you want to work in the office? Where's your ideal situation? She said, assistants, to be an assistant. I looked at her and I said, with your communication skills? And she told me that she said assisting because she was nervous that I wouldn't think she was very good at the front. Meanwhile, I spoke to her and I said, I think she could be awesome at the front. I think she'd become really good. She has something that's God-given. Some people could communicate very well. And as I've said before and before and before, communication is the essence of what we do, whether it's patients, staff, anything. Becoming a great leader, you need to communicate. And what I've seen is people in the front, people in hygiene, when they can communicate, they can move practices forward. And this young gal, today I called that office and I heard this young lady answer the phone. I could not believe it. It was night and day. So encouragement, sometimes we get caught, we as the leaders, we as the doctors, whether it be an associate with a staff member, whether it be a doctor with his right arm, we get caught in the waves and the movement of what's going on in our lives. And we forget we are the leaders. We are the mentors. We have to walk in and say, hey, how you doing? How was your weekend? Stop. Take a minute. I'm really trying that for myself. Lately I've been trying to understand some of the 10 most valuable things that I'm learning. And, it's wake up every day and push forward. And one of the things of pushing forward is becoming better. Culture in a practice is something like a practice. It is always improving or not. I think that it just shapes the complete atmosphere, whether a young lady is scared out of her mind to meet me or she feels more comfortable so she can bring out her talents. That alone tells me we need to develop a culture. We need to develop a practice that people want to come to work. Yes, it's work. Yes, it's hard, but I wouldn't do it with anybody else but this team. And I got to tell you, we as dentists, we're the ones that need to bring this attitude. I walk into Main Street, USA. It's all right. It's not the best place. I look at it, 3-4 chairs. I look at the team. They couldn't care if they're there or they're somewhere else. That is not the team I want. I want people to really grow. And I want people to really feel that this practice really cares for them. And if they have an issue, with family. And that's the culture you bring. I think some of the things that are very important, and we're going to get into it down the road, and I'm going to give you a little bit of an update of what's happening in the next few weeks, which is so exciting. This podcast, first of all, again, welcome. to Dentistry Beyond the Numbers. I've been so excited about talking hygiene because I got to tell you, I was on a panel a couple of years ago with Rolando Mia and Amber Auger, and we spoke about hygiene. And, I didn't realize, but I was such an advocate for hygienists. I am a pro hygiene. I believe if I have a great hygienist or two or three, I could build phenomenal practices. But I could not build them without culture. Because the culture of the practice and giving people the opportunity to grow is the most important thing. I don't care if they're assistants, if they're hygienists, front desk, or even associates. Every single person should be recognized. Every single person should be appreciated. If they take a great impression after we rip them for not a good impression or a scan, let's appreciate them. Let's not look at it. Yes, to us, it is just what we pay them for. But for them, they're getting better. The most and last thing I'm going to leave you with is something that's very near and dear to me, professional development. I want to circle back. We're going to talk about culture to some of the doctors that are going to come on, invest time in learning about this and what their culture, what their slogan or their mission statement is. You can have a mission statement. That is the number one thing of culture is have a mission statement. Bring your team along. Remind them. Our mission statement is patient-centric and doctor-focused, meaning we want to give our doctors and our providers the best tools to present and deliver the best care, all along increasing and improving our patient experience. That's what we're looking for. That's the culture. How do we get it? Well, one of them is professional development. And I can honestly say, one of the things that attracted me when I sold my business to Guardian Dentistry Partners was something called the GROW model that we've instituted. I think it's phenomenal for young docs. I took it to another level, but I think young doctors need to pick things that could really develop their skills, both in the office and for their personal growth. So I'm talking about the Khamsa. And again, we'll go back to those 5 procedures. And I want, like we discussed, to develop those doctors to be so good, but it is a constant improvement. You're never done. They say learning is never done. You're never done. You're going to grow, whether it be better crown and bridge, more surgical training, better retreats, going to advanced on root canal therapy, cosmetics and bondings or veneers. These are the things. If you're an assistant, think about it, doctors. If you're an assistant and you ask an assistant to start scanning and doing things and they're getting better and better and you compliment them, they're going to want to learn how to make temps. They're going to want to learn how to take better impressions. They're going to want to learn how to be more of a help. Hygienists, open their eyes to professional development. Give them reasons to speak to the patient about sleep, about more crown and bridge, about arrestin and gum disease. We have the opportunity for professional development. Front desk people, office managers, there's so much out there to really learn how to manage and control our practices, that if we have a culture of learning, of culture of advancement, why would somebody leave our practice? So what I think culture does, and I can tell you how many doctors, how many assistants, how many front desk people come to me, even doctors say, I really just don't like that practice. And I say, why? They go, I don't want to get into it. Well, the red flag is culture, because they're not comfortable. Maybe the assistants talk about them. Who knows what happens? But somebody could come over and that could be the reason. Another thing can happen is that once you develop that culture, somebody could come over and say, I'm never leaving. I love this place. I feel respected. I'm growing. I like my team. I love the manager. The doctors treats me with respect and he compliments me. So that's an aspect of retention. You don't need to spend a lot of money on medical insurance if you treat them like you want to be treated. I wanted to bring that in now because I feel that we're going to be going off to some other areas of dentistry. And we're going to be speaking to some exciting doctors that have really been greats in dentistry. I want to be a guide. I want to be that guide. I don't know if you guys ever saw the show The Millionaire. The Millionaire was a show back in the 70s where this gentleman would take money from an old, very wealthy man, and he would go around the country meeting people that were outstanding. And he would knock on their door, come in, and he would write them a check out of the blue for $1 million. The people were shocked. Some of the stories were unbelievable. But there he was. He wrote a check for $1 million. I think some people in dentistry can help us learn everything we talk about and more. They've been so influential in the growth of dentistry. I really want to get into the digital workflow and showing how digital workflow really lowers the cost of lab work and betters the quality to the patient. Digital workflow is important. I want to look into really how doctors, what gave them the cojones to go out and start companies and grow these companies. I want you, the listener, to learn about this, to hear about some of the docs that I know that are out there that are willing and able to come on and discuss their story. And over the next couple of months, we're going to be announcing it. We're going to be marketing it, but we're going to be talking about it. But I want you to meet some of these people because to me, they're constant mentors. They give me too much kudos. I'm loving the fact that they want to come on and talk about their stories. And I think we're going to have tremendous learning experience from it. To wrap up today, it's simple. Great hygienists are hard to come by. Well-trained hygienists are great. And culturally accepting hygienists are the key because they are the leaders. They advance us. Number one, with them, you could treat and plan a lot more. With them, you could bring in new products and new procedures and take it from there. But those hygienists that you integrate into your practice that have been there and are very important will stay and be integral to this growth of the practice. And what's the most important today is culture. We want to be treated with respect. We want to be respected and complimented when we do a great job. When a patient comes back and says, I came back for Susie, the assistant, she was so gentle. Susie, the assistant, should get something, whether it be public praise to the practice on the next staff meeting or huddle, or whether it be buying her lunch. But make it known because everyone should know you appreciate culture. And of course, just taking individual careers to the moon. It's in your pocket. It's in your ability. What are we waiting for? Let's get out there and become freaking amazing. I mean, that's what it's about. If I have a cultural office that wants my team to grow and you're an associate of mine, let's pick something. I like to keep it in the Hamsa, right? Root canal, clear aligners, root canal, crown and bridge cosmetics, surgical extraction, bone grafting, and implants. I want to move the practice forward and production forward. But the quality that we're going to deliver is second to none. That's it in a nutshell. That's Dentistry Beyond the Numbers. Learning what is out there, what could be done, and how simple it is to treat our staff with respect. Come on, everybody. We're great. Let's be the best. These sessions are flying by. I'm loving what I'm hearing from people. I'm always asking, please let me know. Tell me how I'm doing on any platform you listen to it. I think we've touched on some great things. I think we're going to go forward with this and really develop so much in dentistry. You know, dentistry is, you can tell I'm passionate about it. You can tell I love it. And I'm really grateful that I know a lot of people that I can bring to you, the listener. Today's episode is something to take home. Remember those people, the hygienists and the team. Remember to build culture. I'll leave you with this. The most important people that we, the doctors, need to impress, I say it all the time, is our team. We want them proud that they're working for somebody like us. From that, everything grows. If they walk in happy and prideful that they're working for an honest, quality-driven team or clinician, they come to work on time, they do the extra mile, they believe in where they are. Thank you so much. This is Dentistry Beyond the Numbers. My name is Dr. Marc Liechtung. Like me, dislike me, quote me, don't quote me, but definitely give me comments. Let me know how I'm doing for you. And always let me know if I can help by providing a topic that's interesting to all of us. Remember, everybody, I'll see you next time on Dentistry Beyond the Numbers. Thank you so much.